football. We've been talking about injuries all throughout the show, so we would like to welcome in Dr. Desai from RestorePDX. Thank you for being here. Plenty to talk about when it comes to the Beavers and injuries.
Yeah, a lot of injuries this weekend. I heard there were 5 MRIs on the players from last week.
5 MRIs. Yeah. Wow. Well, we got you ready with our In-Focus Mondo Pad, the new way to collaborate, and we want to start with Storm Woods. Of course, the Beavers rely on him running the ball at running back, and he sprained his knee last week against Utah, and here we have the knee. What do we make of all this? We have had some encouraging news throughout the week with Storm Woods.
Yeah, so he had a sprained knee, or diagnosis of a sprained knee, but they had him running full speed in practice today. It looked like he was cutting well. So when you have a sprained knee and you're still doing well the week after, the likelihood is probably a grade 1 or mild stretch of the ligament or tissue. An example here is this is an ACL, or anterior cruciate ligament. And so the way we can diagnose a strain is usually with ultrasound or MRI. And grade 1 strain is something that is a mild stretch. It still can be painful. Grade 2 is when you have some partial tearing, and then a grade 3 is when it's completely apart. And obviously, depending on the grade 1 being the most mild, you can return from that pretty quickly, and it sounds like maybe that's what it is. So it's really how is he going to tolerate the pain?
Yes, any concern with going out and playing, as we're expecting he should be available at Stanford? Any concern with injuring it even more than what happened last week?
And that's part, for the doctors and the trainers to decide. So if they know that it's maybe more towards a grade 2, it's something that you want to consider. And even if he can play through the pain, that you may put him at a little bit of increased risk. If it's a really mild strain, that you can do some light bracing and he'll probably do well.
And then we also had a very serious injury to one of the receivers, and we are going to go now to an elbow, which Richard Mullaney, one of the the team's key leading receiver, most experienced, broke his elbow and is expected now to be out for the season.
Yeah, it's unfortunate. The junior receiver, it sounds like he's going to be out. They talked about him being in a cast. And so it'll be interesting to see. We haven't heard of any surgery needed, so hopefully it's a relatively clean fracture, not something that's more complex or that requires surgery. And if he's already casted, there's no plans, then that's promising. So if there's not a fracture, obviously you worry about how many pieces are the fracture and how displaced is it, and then is there involvement inside the joint. So once the fracture starts to go into the joint, then we worry about cartilage injury and other things like that. The cleaner and, if it's in the shaft of the bones, those heal pretty well and relatively quickly, but he still will probably miss the rest of the season.
What normally is the recovery time for an injury like that?
It varies. Like I said, it depends. If it's a hairline fracture, it can be a few weeks. If it's something that's more significantly displaced, we're looking on the order of several months. And especially with the rehabilitation, he's going to have some atrophy. But to get back to playing, then it's not only the tissue healing, but then now he has to get back to full strength and speed.
Wow, I tell you what, the Beavers could use a whole team of doctors at this point. It's been a tough season with injuries, so thank you so much for coming to give us a little more insight into the sprained knee and the broken elbow.
For sure. Thank you for having me.
All right. Thank you so much, Dr. Desai from RestorePDX. And when we return, we will go back to the game against Stanford and take a look at what's at stake after that double overtime loss against Utah. Stay with us on #BeaversFootball.